2017, we spent a fair amount of time focused on this issue of addiction. Initially on the opioid epidemic, where we launched a campaign last summer, focused primarily at clinicians, in fact, and at changing prescribing practices. And then later in the year, we issued the first ever Surgeon General's report on substance use and addiction. But we're going to continue our focus on addiction during 2017 because it is an issue that's affecting everyone in our country, either directly or indirectly. It's affecting communities of color, it's affecting people who are rich and poor, people who are in rural and urban areas. It has really penetrated every part of our country. In fact, last summer, I was in Alaska visiting a small fishing village called Napaskiak. Napaskiak is actually only accessible by boat. There are no roads to this village. So we took a boat and we went there. And in this village of around 500 people, they had a small room there, which couldn't have been too much bigger than actually the front of this auditorium, where they actually provided medicines and first aid to people who were sick. And in that small village, with that very small building to provide medical care, people had broken in to that building multiple times over the last several years looking for opioid medications. And they told me they boarded up the sides of the building and people then came in through the roof. And it was striking to me because even in this remote village which has no roads to it, the opioid epidemic has reached their shores. And that's why we're continuing to focus on that in 2017.